We'll now place the buccal pit amalgam on tooth number 19. Begin with the end in mind and inspect the preparation for depth and perhaps some retention grooves that the dentist may be placing to retain the amalgam. In the buccal pit, we demonstrate both convexity and a concavity in the position of the buccal groove. We'll want to reproduce both of those contours to reproduce the original anatomy of the tooth. We place our first increment of amalgam with the amalgam carrier, condense with overlapping strokes towards the axial pulpal floor of the cavity preparation. Use lateral strokes, especially if there are areas of undercut, so that the amalgam fills the entire cavity preparation without voids. Place the next increment of amalgam and repeat the process of overlapping strokes towards the axial pulpal line angle, and in this case towards the cavo-surface margin. We're still slightly underfilled, and the next increment should bring us all the way up to a slight overfilled condition. I like to switch to the larger condenser end at this point and condense using the adjacent to cavo-surface anatomy as a stop for the vertical condensation strokes. Note that I'm changing the angle of the instrument to help to develop the buccal groove. The initial anatomy of the buccal groove can be developed even during the condensation phase. We'll move the excess out of the way for visibility, and we can use the side of the condenser to develop curvature and do our initial burnishing. We are to slight overfill. We want to have a little extra amalgam that we can finish down to the tooth anatomy. And now we wait for the initial set of the amalgam.